alaikum. This is Dr. Zahra Alhaj Issa. I am an internist, and today our lecture is about a very common, very important, and very interesting topic, which is sickle cell disease and vaso-occlusive crisis. Our lecture today is going to talk about the normal RBC shape, content and function, definitions and subtype of sickle cell disease, its epidemiology, genetics background, its pathophysiology, clinical features, investigations, long-term management, and ending with the vaso-occlusive crisis as an example of acute complications. So this is the RBC, or an erythrocyte, and it's easily recognized by its round contour and pink red color with a central valor, giving it this characteristic donut-shaped appearance in the blood smear. The normal mature red cell measures 6.7 to 7.8 micrometers, and it has no organelles, no inclusion bodies, and it's eosinophilic in color, as we mentioned. And it's more abundant than WBC or platelets. It's a result of a long erythropoesis, which happens in the bone marrow. This erythropoesis will take 7 days to finish, and then this red blood cell will circulate for 120 days before it reaches finally the spleen, where it undergoes catabolism and eventual reutilization of its content, mainly iron. This is the hemoglobin, the main content of the red blood cell. It consists of 4 protein subunits called globins, each of which is associated with a non-protein heme group. Heme carries the oxygen, which is the main function of the red blood cell, and is composed of iron and porphyrin, and it's brightly colored, and it's the cause of the red color of the blood. As we mentioned, there are 4 globin chains, 2 alpha and 2 beta in the adult hemoglobin. Normally, the alpha chain remains constant through life time, but the other chain initially is called epsilon in the fetus, then gamma in the neonate, and then it changes through different stages of development until the normal adult hemoglobin A, which consists, as we said, of 2 alpha, 2 beta subunit, and by 1 year of age, it's going to be present at 97% of all hemoglobin. So this is the scenario that can be almost seen in any ER. A young boy holding his back or his leg, screaming of pain, and after a few minutes he's rushed to an ER bed and the case is clear. As he's being admitted, he's comforted, reassured that he's going to be taken care of, while he's quickly covered in a warm blanket, hooked to IV fluids and oxygen, and given a strong analgesic. Shortly afterward, a thorough history and physical exam is conducted. A set of labs is sent, X-rays are taken, all looking closely for the cause of this crisis and ruling out any other acute complications. If you hear or see this scenario, you will know what this lecture is going to focus on, as we mentioned, vaso-occlusive crisis as part of acute complication of sickle cell disease. Sickle cell disease is an umbrella term that defines a group of inherited diseases, including sickle cell anemia, hemoglobin SC, and hemoglobin S beta thalassemia, all characterized by mutation in the gene encoding the beta subunit of the hemoglobin, HBB. It's a autosomal recessive disorder, as you may know, and it arises due to a mutant beta globin chain, most commonly because of a glutamic to valine substitution at position 6 of chromosome 11. This will result in hemoglobin S variant rather than hemoglobin A, which is the normal adult hemoglobin. Sickle cell disease will occur when the individual has 2 hemoglobin S genes, because it's a recessive disorder, as we mentioned. So if a patient is homozygous hemoglobin SS, they will have the disease. Other scenario of patients having sickle cell disease, if the patient has 1 hemoglobin S gene and another mutant beta globin gene, which is called combined heterozygous. This will be presented later on. There might be hemoglobin SC or hemoglobin S beta thalassemia. This nice illustration by published in Nature shows you what a normal hemoglobin A is consisted of, 2 alpha and 2 beta chain. This is the HBB gene, 2 alleles. This is the normal HBB gene. Here, when the glutamic acid is substituted to valine, this is the beta S allele. If the patient has only one allele affected, they will be a carrier of sickle cell or sickle cell trait, but they will not have the disease itself. These 3 persons will have the disease. First one has 2 alleles affected by beta hemoglobin S. Then this patient has 1 hemoglobin S allele and 1 hemoglobin C allele. Then this patient has 1 allele of hemoglobin S, and the other is hemoglobin null beta allele or hemoglobin beta plus allele, which are 2 variants of beta thalassemia disease. The hemoglobin SC disease, they will have a bit of milder hemolytic and vaso-occlusive crisis, while the hemoglobin S beta thalassemia, it depends on if there's any beta chains or if there are no beta chains at all. If there are no beta chains at all, they will have the same manifestation of sickle cell anemia patients with microcytosis. If there are any beta chain left, they will have a bit of a milder disease. So what happens? We have this hemoglobin S, it's deoxygenated. When it's deoxygenated, it sickles. It's a reversible process, but with time, these cells will be stuck in this sickled shape, which will be the whole pathophysiology of the disease, as we will see later on. In this worldwide map, you will see where the sickle cell anemia cases are clustered. In Africa, India, Middle East, South America, with different numbers.